Hello, everyone. John Scavola, your facilitator for tonight's Zoom call on for practitioners only. And this call is really designed for as a master sharing group for practitioners only, particularly terahertz practitioners that are using terahertz types of products here in their practices. And next Thursday, we will start a Zoom call specifically on the quantum scalar energy functionality of the IteraCare products. But this call is really about how you're using terahertz in your practices. And as I mentioned earlier, we have a wide range of different types of practitioners from naturopaths, homeopaths, chiropractors, massage therapists, physical therapists, medical doctors, because we want to find out how is this working in your practices, and look for innovative ways that we can help so many people out there that need help. These calls are strictly about the Prife types of products, and particularly the IteraCare. However, there are some other products that are very, very appropriate and exciting for practitioners, particularly the Itera Bio Lite and the new OxyTap water oxygenator product that's coming out. And these are amazing. Direction, what would you guys recommend?
Well, I can kick it off.
Okay.
Hi, my name's Yvonne, Sacramento, California. And so a story I want to share with you. One, if anybody got to hear the audio from Dr. Cochran, that was pretty incredible. I'm going to point out two things from that because this experience is based from that. He mentioned, I believe the company says, don't expect any results before 10 sessions. And of course, most of us know it's happening in one, right? And keep using your device for 90 days. Dr. Cochran mentioned, for those of you that were not, getting the expected results, increase your time on the area of concern. Well, I did that. I am former military, worked in the medical and the dental field, had toxic exposure from Camp Lejeune when I was serving with the Marines. And so I've had tremors for over 12 years, internal tremors. And I'm on this wellness journey and have tried everything that I know to date, lots of frequency devices. And it was with the terahertz and increasing my time after 90 days that I had my first change in the my internal tremors. They're constant 24/7, and probably about, I'm going to guess, 3 to 5 sessions into increasing my time, and I went to 25 to 30 minutes. My internal tremors are intermittent now, and I am very excited about that. There's about 9 of us at our clinic. We all are using the device. We've got tons of stories, but that was one that I just wanted to share with you. There's 1 or 2 on here. Hopefully they may share their story as well, but we're all getting personal experience and results. Oh, and my hairstylist says I'm not graying as often as I did before, and my hair is growing longer, so faster and longer, and that's been pretty exciting as well, because usually by 4 or 6 weeks I'm much grayer. I'm at 8 weeks and it's minimal. So if you haven't experienced that, make sure you're drinking the water.
Thank you.
Yep.
Who else?
I'd like to volunteer Dr. Joe. I know he's got some good stories.
Yes, I have a couple stories. Had a patient that was in an auto accident and experienced a concussion. Had been treated for about 6 weeks, and she was an employee at Duke University and lost her job. Couldn't look at the monitors anymore and had a difficulty time riding in a car without throwing up. And she was seen. I mean, I'm a chiropractor, and I was treating this patient just chiropractically, and I got the machine, got the device, and started using the device on her. Every time she came in, we did top of the head, the hands, the feet, and I probably spent, I'd say, probably 20 minutes just with a wand with her. I know that was a long time for me to spend with her, but I hadn't trained my staff, and so I was just doing this myself. But within about 5 visits, her symptoms cleared up, and she then bought the classic and started using it at home every day. And so after about 5 visits, her symptoms went away. She was able to ride in the car and do the normal everyday things. So she's a real believer. She really, really improved. Had another patient with cellulitis in her legs. Both legs were swollen, quite large. She had lesions on her legs. I did probably again about 5 visits with her, and she called one day after the treatment, and she said, well, we could see every time she came in that the swelling was going down and the lesions were clearing up. But she called once and she said she can now get in her shoes okay. Her feet were not swollen. Her sores were just really healing up good. And she said, I've lost 5 pounds out of my legs. So that was kind of the conditions. And today I had a patient that came in with had shoulder replacement surgery with very limited motion. And I worked on that patient again for probably, I don't know, 10 minutes, 12 minutes, somewhere like that. And range of motion was increased probably around 20 degrees, probably, just in that one visit. So it was really impressive. And she could lift her arm without, pretty much without pain. When I got done with her, but I use the machine on almost every patient now. I was used to do some, like some heat and some electric stimulation, interferential and things, and now I'm just using the wand on them. It seems like it works so much better, and I'm looking forward to that new one with that's not so noisy. So those are a couple stories that I've experienced with patients.
So let me interject here. Ian has a question for you, Dr. Joe. He wants to know, do you have them drink wanded water before and after?
I haven't taken that time to have them do that. I think that would probably be another thing I need to do. I can't wait to get the OxyTap.
Yeah, that's a whole nother call. That's the combination of that with all these other modalities that we're doing is it's going to be amazing.
Joe,
Looks like Therese has her hands up. Is that right?
excuse me, one last thing, just one more question while we're on Dr. Joe.
Sure.
The question is from Dr. Misty. What model, Joe, are you using in these treatments?
I'm just using the I guess it's called the premium, not the pro. Yeah. I was afraid of spending $4,000 and just so I know that's what I went with, and that's what I'm using right now.
Great. And yes, Therese.
Hi, I'm from Sacramento, California. I am a client of Yvonne's, and I am using the red light right now on my complex regional pain syndrome on my ankle, my right ankle. And I have tried numerous things to help with the pain. But this has been the only thing that has helped me. And I have noticed that when I use it, it takes away the burning and the stabbing feeling. There's still an overall discomfort in my ankle, but it's not unbearable. And so I can definitely say that the red light has made a huge difference. And I would recommend anybody who has complex regional pain syndrome, which is really difficult, that this is something that I think helps. So yeah.
All right, thank you.
Mm-hmm.
Well, Michelle, looks like you made it to our call here. Jeff, I know you guys have a lot of stories out in your clinic. Put her on. You think?
Okay, we have another question in the chat.
Okay, we'll
Yvonne,
get her.
your hand.
Who's that?
Well, you can ask the question in the chat first.
Okay, it's what's Yvonne's business name in Sacramento? I'm in the same area.
Oh, for a better you two wellness with the number 4. I just wanted to point out, I think Michelle LeMay has an incredible story about eyes, and I was hoping that she might be able to share that.
She said, can't speak while I'm listening.
Oh, darn. Can I share her story?
She says yes.
I'm not likely to get this exact. Michelle has been wearing glasses since she was 14.
Hmm.
And then she, moved into contacts. And after using, doing the 10 points, she was very faithful to drink the water. Not only before and after, but during the day. Her drinks included it. And I believe it was roughly 5 or 6 weeks. She went to have her eyes examined again, and they told her that she no longer needed a lens in, I think it was her right eye. So right now she's running around with just one lens, and she is a very sexy 60, and from 14 to 60, she's been wearing glasses or contacts. So something is going on for sure.
Wow. Look forward to hearing more of her story there. I know the LeMay Clinic there did a video not too long ago I was just amazed at all the testimonials that the folks were having there when they did the open house. Ian, did you have a call? Do you have a question?
Well, a quick testimony.
Okay.
The way I was introduced to iTerra, and I'm sorry if you hear my cat in the background, is my best friend and I got introduced to it, and I was going out to be the executor of his estate. He was going in for heart surgery. He was going in for several things. He is now going to be 69 today, and he's healthier than I am. That was 2 years ago, pretty much. And there are no surgeries, no nothing. He's getting healthier and healthier. Varicose veins are gone. Eyesight's better, earsight's better, hair's more fuller. Play in his knees are better. He can walk up 3 flights of stairs without pausing. The wand has done tremendous things for him, and he's, he wants the classic. He only likes the classic, and because he's getting the results. I'll be interested to tell him about the new Premium Plus. So, but yes, terrific results.
That's great.
Okay, we have a question in the chat for you, John. Therese wants to know, what exactly does drinking the water help with?
So in the basic 10-point protocols that we all are fairly familiar with, it says drink 2 glasses of water before you wand and then 2 glasses of water after you wand. And I've been involved with Care for 2 years. I have never done that. Oh, did I say that? The So, however, I'm not saying that I'm a good fellow with that, because what's going on here is it's not just energizing your body. It's not just restructuring the water so that your cells can absorb it easier and be super hydrated. Really, what's important is, those are important, but what's really very important is when you shine the terahertz through your body, you're creating an internal sauna effect. The vibrations between the terahertz and your cells create millions and millions of vibrations. That resonance creates an internal heat that is extremely self-healing and healthy, and will actually kill off unhealthy things that are in your body that shouldn't be there, that don't want to be at that kind of temperature. And that is dehydrating, that whole experience, that inner sauna effect. Okay, have you ever been out in just a regular sauna and you're really thirsty? Well, imagine if this is like way more than that, what's going on just from shining that on your body. That's why they say don't necessarily shower right away, because you've created this internal healthy heat going on inside your body, and you want that to go on for as long as possible. But you want to hydrate your body. Again, don't be drinking cold water there again, because that'll cool off your body. You really want that internal heat that's happened there good to go on. And by drinking the water, you're going to hydrate your body before and after. In addition, you're detoxing all that internal heat, all that healthy stuff that's going on there is getting rid of stuff that needs to flow out of your body, and you need to drink water to help detox. So it's not just we're trying to sell more energy water. It's really recognizing how valuable it is to create restructured water, and the value of that. And have that water travel through your body, energizing your cells. But it's also very important to hydrate your body and to help it to detox and flow things out. So, yes, the Margaret? Oh, you're muted.
Ian, did you have another question?
Yes, well, it's actually a statement. I'm friends with a few scientists, and they did experiments with wanded water and non-wanded water, and the wanded water penetrated with plants, penetrated further and allowed them to grow much more. If you do the research, terahertz really is attracted to water. And if you look it up as far as linearizing everything, if you look up blood and terahertz, you'll see how it linearizes everything. It's a cluttered mess, clumps of different red blood cells, white blood cells, and then after you've drank the wanded water, it's more linearized. That means it can go to the finer capillaries, it can go to the finer cells, it can help flush, it can help treat, it can the penetration of the terahertz goes deeper into the furthest part of your bodies. And it is so important that drinking water, wanded water. I see practitioners like my massage therapist not encouraging people to drink the water, and they're lukewarm as far as the results, because they're not getting the results with the wanded water, I believe. So I think it's critical that we really push the drinking of the water to our clients before and after. And I know in a clinical environment, that's kind of tough to do, having them drink before and after, but I think the results are so much better.
Thank you. Great input.
You should hear me now. Do you hear me now?
We do.
Okay, so I have a question about how do we work with iTero when someone has implants, dental implants, or any metal in the mouth or somewhere else?
So I'm open to anybody else who wants to throw that out. I have my viewpoint on there. Anybody else have experience with that or thoughts? Okay,
I'll put something in there.
sure.
You can wand all the way around the area. You can do referred points. If you look on hand, on the foot reflexology, look on the back, there's referred points that you can use in order to attack the area. I have people, then there's also, you can go on to the bio. The bio light, I've had people with implants in their feet, arms, legs, head, and I hadn't had any issue with the bio, but with the wand, you can't do it directly on there. Implants on the teeth. If there's mercury in there, I say watch out for it. But otherwise, the other implants, I haven't had anyone have any problems with that.
Thank you.
And at the very least, you want to keep moving, keep your wand moving. Don't focus on any one of those areas where there's metal or whatever, where you're potentially could be heating it up more, especially with the thermal part of the heat. So do all the points that Ian's talking about. Do the energized water and move it. And I have implants, and I've been wanding my face and mouth for 2 years now with no issues whatsoever. My wife has some metal in her leg, no problem. But just don't point that at that area. Now, as Yvonne was talking about, there's a magical number in using the Prife product, the AnteriCare, of about 15 minutes on a specific area if you really want to see some really accelerated results. So sometimes we do our body, and maybe you have a frozen shoulder or something, and you want to spend about 15 minutes on that area, but just keep it moving. Now, if it was metal, just don't focus on some specific area and heat it up, because you can go over it. It's not going to be a big problem if you go over your head and you're doing your body there. But I wouldn't focus on some metal area if you're concerned about that way. Yeah.
Thank you.
Yeah. And the Atera Bio Light is phenomenal. What they can do for you, but they don't replace the AnteriCare. There are folks that are not selling knockoff foot massage devices, and they're going, "This is so much better than the AnteriCare," and they're thinking, "Well, you're lying. It's because you don't have a wand like we have, and it does what it does. You can't charge your water. You can't use it on your animals. You can't do the kinds of things in face and skin care and all the kinds of stuff that we know we can do here." So it's a very complimentary, phenomenal device. And for some people, it may be the only device they can use, but if preferably you want an AnteriCare first and then one of those. But it is wonderful to use at night when you're watching TV, and slide it over to my wife and she slides it back to me, and we do our AnteriCare Light because it's totally quiet. But it does not replace the AnteriCares and the miraculous things that those can do. Who else would like to ask a question or share something? Yes, Linda.
When I went to a presentation that Yvonne was doing on the wand, I realized that I was having numbness in my toes, possibly because of my sciatica stuff that I had when I was a lot younger. And so I started wanding my tailbone quite a bit and my toe areas quite a bit. And most of my numbness is gone.
Wow.
I have it intermittently in my right foot, but I don't feel it at all in my left foot anymore. And that what to me was pretty major because I was starting to worry about like, what am I going to do if this continues to get worse? What is this? And so I loved the connection with the sciatica and the tailbone area and how that effectively does a lot for the areas all the way down the legs for me.
Thank you. Marcus?
Yes, I'm a doctor of naturopathy and acupuncture in 1971. And in recent history, I've had a number of clinics and hospitals asking me to do acupuncture for them because it's on their national health. And it always ends up me leaving because I prefer to do other things. And this is one of the other things that I like to do. But I've got a lot of questions. Yeah, really, really good results out of using the classic. And these were mostly in a private hospital in the Philippines. And people that I didn't know what to do with. Like I had one patient who'd fallen, a 60-year-old guy who'd fallen off the roof of a church while he was fixing it. And he had all sorts of injuries. He'd been bedridden for 6 months. He'd been in intense pain for 6 months. He hadn't slept for 6 months. And he had a lot of edema and bed sores. So it made any physical therapy difficult to do because of his condition. So he was on a stretcher when he was brought in. And I used the wand on him. I used the classic way of giving him water and doing the protocols and applying it to the parts of his body where I thought it could. I also, with the patients, I also teach them a lot of self-help that the family can do with them, of getting their body moving again and getting the circulation moving in parts, which that's quite a major part of my homework for patients, is to get them to move, even if it's small movements of their hands or feet or legs, just to get the oxygen flowing through their bodies and so forth. Anyway, when I was taken to see him a couple of months later, and he was up from bed. He wasn't in pain, and he was helping himself around the house with ropes strung across the ceiling. So that was a great success. But
Wow.
one of the things, I've got too many of them to tell here, but one of the things that I was interested in was for my own sake, because I've had quite a lot of problem with one of my eyes. I've had glaucoma in both eyes. I've had all the little things they do, the little modern laser treatments and punching holes in things. And what I wanted to do, and when I was in the Philippines about a year ago, I went to the local eye doctor and I got him to examine me. And then after the examination, he did all the tests. I said, "Would you mind writing a report?" And he said, "Why?" And I said, "Well, I wanted it in writing because I wanted to go home and use the iTero and then go back and show him what could be done with his clinical results." I never got to do that for one reason or the other. However, at the time, I was a little concerned about some of the literature that I read, where one of my eyes, which has perfect vision, my right eye, has had a lens put in it by a surgeon. And it's great, but I read somewhere that using the iTero around that false lens or whatever you'd like to call it, it might damage it or something like that. So I was wondering if anyone could comment on that. And just while I'm there, anyone who's had success with glaucoma would be very interesting to me. And I've heard the iTero is good for cataracts. So if anyone's had experience in that with the eyes, I'd be very interested.
I have had, I've been using the iTero Care, but I have lenses in both eyes and I have not noticed any problem with using it because I know that contraindication as well. And I've been using it on my skin for the last 6 months. So it comes close to the eyes, but I haven't noticed any negative effects at all. As far as correcting it, I haven't seen that either, but I have not directly been putting the Itera Care on my eyes. As I say, I've been doing the skin, and yes, my hair is turning dark brown underneath, and it hasn't been that way for a while. And so it is changing things. All the hairs along the edges are all real dark now again. So I'm definitely seeing changes from it, but from the eyes, I have not.
You have a comment there, Ian? Anyone with implant in the head, titanium in the head? Yeah.
Yeah, I have a client. He has a titanium plate in his head, and he's got stage 3 cancer. And I would love for him to use it, but I'm telling him to stay away when it comes to that area.
Yeah.
But I'd be okay with him to try the bio, but not the wand.
Yeah.
There, if anyone has anything to offer on that, I'd appreciate it.
So I got a quick question. Dr. Ian, are you suggesting he not use it at all or just in the area? Because he could still move all those fluids and have other health improvements, taking burdens off the body, drinking the water.
Mm-hmm.
Or are you suggesting him not use it at all?
Not use it on his head.
Okay.
He's definitely drinking the water. He's definitely, well, I keep pushing him to use it on other areas, but he's also doing several other things. Sorry about the cat. Several other things. And I'm a nurse, not a doctor, but thank you.
All right. I want to just share a quick, another testimonial that came up. Somebody was talking about the water. I have a goji berry plant that's about 5 or 6 years old, and I get about 20 to 30 berries at a time. I started putting the Itera Care in there, and I am not kidding, I get 75. And it just is more lush, it's more green, more berries, and it's larger. I've used it on my other flowers and my strawberries. Oh my gosh, I've got this tower of strawberries. Holy schmollies, not like I've seen before. As a matter of fact, they die off and then they come back. I've just kept watering it. I have strawberries here in February. So something's going on and I'm excited.
Ian, I have 8 screws, titanium screws in my left knee and femur, and I have never had any trouble using the Itera Care on my knee at all and my leg. It feels great. I don't generally have any pain to begin with there. My use of it is probably not as strong as I'd like it to be. I was a ballet dancer for years, and so I know how to use my leg, but I still take ballet and turn out, and I just don't have as much strength in it, but the Itera Care doesn't hurt it at all.
Thank you very much.
I want to add something. I wasn't going to say anything, but Ian, you had mentioned about the value of the importance of drinking the wanded water before and after treatment. And then Yvonne, you just mentioned about your yield on your goji berries. And that reminded me, because if you just kind of extrapolate, I don't know if any of you have ever seen the experiment that has been duplicated several times of the plants where one plant with the same, from the same seedling, they were separated, same soil. One was given microwaved water, which of course is lower on the spectrum, and the other one was given, I think, just spring water. The same water, one was microwaved and one wasn't. Well, the one that had the microwaved water really just pretty much deteriorated. It kind of frizzled up, and it didn't thrive, whereas the other one did. So if we take that and offer terahertz water to a plant, one would think it would do just what Yvonne said. So you've got the microwave and you've got the terahertz. Water is very important.
Well, I've had a scientist friend of mine. He's duplicated that experiment not only on a small level, but on a crop level, and has seen tremendous results. And extrapolating even that on further, taking off the crystal, just using the pure engine, you get zero results. Zero results. So the crystal, the Iteracare crystal means something. It does something. So it's, so the knockoffs on the market with other, they say they have a crystal or glass, whatever. It's not the same thing.
My neighbor has one that she said it's wrapped in their quartz or their crystal or whatever they're calling it is wrapped in gold and silver. But it doesn't sound like, she's getting the same results, per her testimony.
Well, there are a lot of companies that are frantically trying to re-engineer and reverse engineer their TerraCare products because they've seen the amazing experiences that people have had, like we've shared tonight, all around the world. But nobody's been able to duplicate it, so they're wrapping them in gold and silver. They're putting in crushed gemstones and stickers, and they say, yeah, we have terahertz, and but they rarely do they talk about actually, well, what is the actual range of terahertz and what is the penetration? And when they do, it's not the same stuff. And they and we're talking about all tonight. We're just talking about terahertz. There is that third functionality called quantum scalar energy, which we'll talk about next week. No knockoffs out there have that, and that's a whole nother area that is. If you understand what that is, it's like a whole nother world in terms of what this could do.
There's a couple of us here in the Sacramento area that, we've been working together. And I just want to put this out there to the other practitioners. We have purchased a number of devices after we all have had our own experience. But for business purposes, we either appoint for a session. We also purchase some extras and put them in very nice cases, and we rent them out. And then of course, they're available to purchase. We do not upsell, but I'm just giving that out to you because a couple people hadn't even thought about the rentals. And here has been a couple of the clinics' experience. 7 out of 10 are or have purchased after renting. And so, they get to experience it and then have their own changes somewhere in their own family. And, and that's one less appointment that, you take in, but, the goal is to help as many as we can, right? So just wanted to share that. So a couple of us are doing 100 for the week. And some have chosen, if they purchase, they either get that 100 or half of that 100 back. And then we haven't had anybody break the glass. However, the beautiful thing is the glass is now available to purchase for $70. We do have a waiver that they sign, and they do understand, the risk that they're taking, but we also don't charge them. Now that it's been rented a number of times, we're not charging them, like the cost of the device. We did have one where the dog liked the item so much a patient wanted her dog and the dog just, wouldn't leave her alone. He just absolutely loved it. And when she went to work day 3 or 4 in, she said he just started chewing on it and he, chewed the wire and she thinks maybe he was trying to get it to come on. I don't know. She did replace it. And then, we just let her use it a little additional, but, work with, your clients and, but that's just some of the things that has happened here in the area.
Appreciate everybody's participation. Some great stories. And thank you very much.
John, thank you so very much for putting this together.
You're welcome.
Appreciate it. Thank you, Dr. Misty.
Thank you.
Thanks, John. Good night.
Good night.